Coeur d'Alene is a smaller community of about 38,000 found in the northern panhandle of the state of Idaho. Within Coeur d'Alene are a great many respected physicians who have been practicing medicine in well-established practices over the last several decades. Although many have never heard of this hidden oasis near the Rocky Mountains, once they have set eyes upon the gorgeous waterfront, they will remember this small town in northern Idaho. It is here near the Canadian border where I was raised, and have chosen to look at some of the physicians' practices and other healthcare resources into more depth with regards to how they deal with problems of access to care for the under and uninsured populations. Coeur d'Alene Pediatrics is a large practice within the Coeur d'Alene area, serving thousands of children from infants up to young adults. They have been in existence for over 20 years, serving their patients to the best of their abilities. Dr. Mary Jo Shaw, MD, has been a practicing pediatrician at Coeur d'Alene Pediatrics for the majority of its existence. Through email correspondence, she reflected on the services her practice provides and her experience with this underserved population. She responded to the following questions concerning her private practice. We provide care for Medicaid patients. To my knowledge, we are the only practice that takes new patients with Medicaid, with the exception of newborns. Since Medicaid does not pay as well as other private insurances for the same service, it is definitely a financial burden. However, we have very efficient practice. We work our employees hard, so we are able to see a large portion of Medicaid patients. In fact, over 50% of our patients are Medicaid. Also, Idaho reimburses better than a lot of other states. Family doctors do not get reimbursed as well for adult Medicaid patients, so they are hesitant to take children who have parents on Medicaid. Dental reimbursement is also very bad. Pediatric dentists have all restricted the number of Medicaid patients they will see due to poor reimbursement. So even though Medicaid programs state they provide dental care, the parent cannot find a dentist to see their children. Since so many children in our area have Medicaid, we feel compelled to provide care for them as part of our goal to provide pediatric care to the community. Since Medicaid does not reimburse as well as private insurance, many practices will not participate. Some providers also seem to have a bias against Medicaid recipients. Medicaid requires a lot of paperwork for referrals and certain meds, even ones they cover. You have to complete a prior authorization form. The form has to be faxed to the state office, where they review it and fax back the response to you and the pharmacy. If a patient does not have insurance, they are required to pay half of the cost of the first visit as a new patient, as are all new patients. For future visits, they are told to request payment at the time of visit, but we will bill them. As long as they pay toward their balance on a regular basis, we will continue to see them. Mary Ann Daly is part of the office management team for Coeur d'Alene Pediatrics. She works with patients over the phone and in person concerning any scheduling, billing, and insurance problems. As an involved team member without a degree in medicine, she has a different relationship with the patients of her office. The following are her responses to the same questions over email. Yes, we do provide this service. Yes, the front staff has to check each Medicaid patient's eligibility at each visit, since this changes from month to month. Medicaid does not reimburse as well as other insurance plans, but you still have the same overhead. Medical offices have a huge overhead to cover. The doctors decide which insurance types they will contract with. Reimbursement and billing issues. Medicaid does not cover certain procedures, such as circumcisions. The billing staff has to monitor what codes are not paid well. Medicaid requires a referral for a patient to be seen at any office other than ours, specialists or urgent care. There are a lot of phone calls and paperwork involved with these referrals. We do have a program called WeCare that provides well-child checks for children during their first year for free. We do require patients to show us that they have been denied by Medicaid to qualify for this program. Some parents don't want to apply for Medicaid since the mom has to list the father's name. We also participate in a voucher program through the health department. If a patient presents to the health department for an illness and they cannot afford a doctor's visit, the health nurse can provide the family with a voucher to be seen for free in our office for one visit. This does not help with chronic conditions. The Journey Clinic is also a resource for patients with no insurance. We provide immunizations through our office at no cost if parents cannot pay. We are part of the state immunization program, so we get immunizations from the state, but we still have the overhead of the office and staff and supplies. Dr. Robin Shaw, MD, has been an emergency physician for the past 20 years at Kootenai Medical Center in Coeur d'Alene. As a member of the emergency department, he is required to see all patients who come to the hospital seeking out care. He was also requested to answer the same questions over email. Although he is involved with a branch of medicine that is required by law to see all patients, he still can contribute to this discussion of lack of care. Yes, we do provide this care for patients. Yes, however, we have an arrangement with the hospital where we are contracted to get paid a certain percentage of our charges, so the hospital helps share the burden. We are required by law to provide this care. Poor reimbursement issues. All patients are treated equally. They are billed later, so don't pay at the time of service. The billing department for the hospital handles delinquent payments.